Today we are assessing body composition by means of a 7-site Skinfold assessment with a body caliper. The caliper is the only equipment needed for this assessment. All measurements will be recorded from the right side of the client's body. The 7 sites measured will be the triceps, subscapular, suprailiac, chest and pectoral, abdominal, mid-axillary, and thigh. Keep in mind that 3 out of 7 of the sites will have a different fold compared to the others. The first site we are measuring today is the subscapular measurement, which calls for a diagonal fold at a 45-degree angle 1 to 2 centimeters below the inferior angle of the scapula for 1 to 2 seconds. Determine the amount of subcutaneous fat, which is the fat below the skin of your client, for each site. The second site is the triceps, and this is a vertical fold on the site with the arm held freely to the side of the body. The third site is the chest and pectoral area of the client's body. This is a diagonal fold, 1/3 of the distance between the anterior axillary line and the nipple for women. The fourth site is the mid-axillary, which calls for a vertical fold, taken at the level of the xiphoid process of the client's sternum. The fifth site is the abdominal, a vertical fold 2 meters to the right side of the umbilicus. The sixth site is the suprailiac site, which calls for a diagonal fold in line with the natural angle of the iliac crest. The last site for this test is the thigh. This calls for a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease, the hip. These are the formulas that were used to calculate this particular client's body densities. Formulas differ for men and women, so make sure you use the proper formulas.